Good afternoon.
Good afternoon to you, sir.
I am happy, very happy that you are hosting us here. Thank you for having us. We cherish this type of opportunity to connect with the citizens we serve. It's one of our cardinal point of work.
Okay.
I think you are helping us do our work.
Thank you so much.
Okay. And no be only sit down. We get Ibukun Oguntola. Now the senior program manager for Nigerian Health Watch.
Oh, yeah, welcome.
Thank you very much. Good afternoon, everyone. My name is Ibukun. I work for Nigeria Health Watch, and I'm very glad to be here to speak on something that I'm very, very passionate about. I'm also glad to see my guy here around as well. So I'm very, very confident that this conversation will be very, beneficial for everyone.
All right. Thank you so much, Ibukun, for joining us on Wazubia FM 99.5. But going forward, please. This is not pitching session. Don't come and use English and scatter my heads so that we go understand where you from they come from. So thank you, Ibukun. I know say they're on the same page with us. So while they follow our guys them talk inside studio, feel free. I go open my phone line at a point so that you fit ask them questions, okay? Especially our guy from the government side. You know the election that they come. So make they prepare you na mind. So we go ask Oga when Oga don't throw you, I go open my phone, make we throw to Oga too. So that the one way go fit collect. You go collect and go give him people there. Say no, this not waiting my people they want to. So we go open line for you now. But as we they talk, they go anyone where you pin shoe for, but you just turn your belly like this. Send and call my WhatsApp 080-2447-2317. My God already hold battle way go take the jot on you no problem and make carry go meet the other gas at the top. So feel free. WhatsApp na 080-2447-2317. Maybe when we close today, I go tell Blessing make he give us their company or their firm WhatsApp number so that anyone will not feel settled here. Una go forward and to her. So that she go also take them to their body. So make we not waste time. Who of them you want first slap question?
Now Oga dey and Oga will first ask. Since we talk about accountability and transparency for maternal health care, we'll just start from the beginning.
Okay.
When we talk about accountability and transparency in maternal health care, waiting exactly we dey talk about.
Okay, so thank you once again. When we talk about accountability in maternal health, we are talking about three things. There are a list of services that a woman that is pregnant should expect to get in our primary health care facilities, and she should get it in a way that is in a dignified, respectable manner, in a way where there is two-way communication, and she gets it and she's satisfied with the services. Now, accountability means we are able as healthcare workers to provide the services to her, and where there is any misgiving, either because of conception or actual problem, she should be able to approach the healthcare workers, talk to them, demand for explanation, and then if she is still not satisfied, there is a level of leadership at the facility level. She will talk to the officer in charge, we call them, and ask them, this is the services I come for, and this is the level I get, and I think I should get better, or I have some questions that I'm not attended to. So we are, like my sister here said, obliged to serve the population. We are doing it as a duty, and we are doing it in a formal setting, and we should be held accountable, and we encourage this feedback. So accountability means we have responsibilities, we have services that we should provide to the citizens, and we should be seen to be doing that. Where there is either real or observe problem, then we should be asked and we should provide solutions. And then if we can not solve it at the facility level, we have different levels that citizens should be able to escalate. Say, I've gone to this facility, I expect ABC and I could not get. Or there is some bad treatment that is meted at me, and then you give some details.
Okay. While God is talking, I go pardon us. My guests they miss their language, but if they're not going to speak the pidgin, Now go just manage for this time, at least with the understand waiting them they talk. Oga, talking about accountability. We not say many people where they government. Hi, it went away, as in Belego they pay they like this way. Be say you come out at times to tell them, say, Oga, this thing when they do, you know, they right. Because today you want just here, you want stand their white. Especially for those of them who get the intention of, okay, we want to run politics, one thing. They're not going to do the right thing, no. Though they do some kind things to cover it. And when people go, make a side example now, like those two nurses now, where they work for one primary health care, where say na torchlight, now they do surgery. And even patients, then where they hospital, they not even see lights, they see front. Woju, they not even see. Mosquito, you go treat one, you carry another one, you come out. Now, instead of such person where they in charge of that hospital, to take correction and see what thing he go do, instead they decide to victimize those two girls, even expel them come out from that place. Because such not the case, we go make people at times, they go see, they no go want talk because they say, now me want talk. The one we talk yesterday, and I see what they do. Now me can't talk, but they cost to do me like this. So in such cases, what do you advise us to do?
Okay, so you see
You go let me romance my mic, sir. Thank you.
Okay, so you see there are procedures for everything, and I'm speaking for the sector I am aware of. In the health sector, we do not behave typically in the way you painted. We are trained to serve humanity. This is our calling. And we ask and demand for feedback from our clients. So whenever there are complaints or observations or even suggestions, the first point of call, as I have said, is the facility management. If you do not receive the response you feel it is appropriate for you, we have the local government health authority, the maternal and child health coordinator that you can reach out to that supervise those facilities, or director of primary health care services. At national, we have some hotlines, that is beyond the local control, that somebody will come and just eye you and then try to intimidate you.
Okay.
We have hotlines, and I can call the number for you. When you have any problem anywhere in this country with our primary health care centers, you can call these numbers. For instance, if you want to speak in Hausa or English, you can call 0196
0196
824 5000.
5000.
Another number is 0916
0916
839
839
5000. We have dedicated staff that can
5000.
If you want to speak in Yoruba or Igbo, you can call 0916 827 5000 or 0916 849 5000. All of these four numbers you can communicate in English or Pidgin. But when we want to speak for either House or Yoruba, these are the numbers. So you call, we have dedicated staff that will listen to you, document your observation and complaint, and take it up and then give you feedback.
Okay.
All right. Thank you so much, Doctor.
In our website, in the office also, our website, www.mpsca.gov.ng, we have a section for contact us that you can drop message, either through email or direct message. We have WhatsApp number there. So we are open and our doors are open. And most of our facilities, they have suggestion box. That you can put out your observation and feedback.
All right. Thank you so much.
Very recently, we'll be launching patient bills of rights.
Okay.
So that we are promoting this transparency and accountability. It's identified the list of services a client should expect, list of rights of the client in those facilities, and the list of obligations that the client has to abide by, and then a QR code and phone number that you can use live to communicate and send your concerns and observations. Very soon.
Okay, like when would they talk about this right? Just let me throw like 2 examples of the rights of these patients.
So there are about 10 rights. But you ask of 2. First right is the right to get correct and complete information about their care. It's not just for me. You are talking about headache, fever, and then I'll just write drugs for you. I'm happy to explain to you What are your treatment options?
Mm.
What am I managing you for? And then if there are some options, I'll give you choice to. So right to correct and complete information, right to be treated with respect and dignity,
Okay.
and the right for emergency and urgent care, irrespective of your religion, your tribe, your political affiliation, and whether you are rich or poor.
Okay, you talk. Sorry, Mr. Ibukun, we dey
Ibukun.
come to you now. We dey talk about emergency. You know, say in some cases when people go they emergency, then bring them come. You go still see whether nurse or doctor or the receptionist there. They go still they say make deposit before we go attend to this person. And in most cases, we they lose this patient, they go die. You consider don't they put blame to say you know attend to this person for not die, you know, because some of them actually they put money first before the life, especially for that right. So you they talk about now right of emergency.
So you see, we may be talking about what's obtained in the past. We have made it clear that the policy is human life first. Attend to the clients, and then you sort issues later, whether it is money issue, whether it is a criminal case. I think this is thing of the past. I am not denying if there are some cases that are outliers, some people that do against what we ask them to. But the teaching and the guideline and the policy is you attend to human life first, stabilize the patient, make him or her stable, and then everything will continue. If there may be, it is not everything that is free in our health sector.
Okay.
So if there may be need for payment after you secure the life of the person, then you demand for those, and then other administrative issues. But the right that everyone has is to be cared for, especially in those circumstances I mentioned.
All right. Thank you so much. All right. Blessing, which question you get for Mr. Ibukun?
Thank you, Oga Garba, for that. Oga Ibukun, I want to ask you about this WDCs, these World Development Committees, and other community structures. How they feel help women raise concerns about the quality of maternal health care within their community.
Okay. Yeah, thank you very much for that question. I think just to build up on what my Oga has already said, I think he said a few important things around how, first of all, women need to know that they have a right to complain. Yeah, I think that sometimes goes missing when you're in the communities because they feel like, okay, it's whatever they give me that I just have to accept. But they need to understand they have a right to complain. And like he said also, there are structures already in place. There are procedures on how to raise your concerns. So like I said, the first step is always to speak with the health worker that is attending to you. Okay, they did something, they spoke to you in a certain manner, you did not like it, or they did not explain something. The first thing is to talk to them and say, oh, this is the issue. This is my issue with you. All right. And if those concerns are not then addressed, right, then they can then escalate that to the officer in charge or the facility in charge. Then also, if the facility in charge is not able to address those concerns, there's also another community level structure, which you just mentioned, the World Development Committees that are in charge, essentially in charge of the facilities within their wards. And what that enables, what that structure is really meant for some level of community ownership so that people that live in those communities, that live in those wards, know that they have some responsibility, some ownership over the facilities within their, their wards and their locales, right? And those ward development committees have a right to also review what the facilities are doing. So they have some level of influence over those facilities, right? So even if the health workers are not listening or the officer in charge is not listening, the ward development committees have a right to also inquire and investigate issues when they arise, right? So our community members need to understand that there is that ward development, that WDC at every ward. As long as there's a facility there should be a ward development committee. And those ones then have the right to then even escalate issues further if they are bigger issues. We see issues around infrastructure, no equipment, or the facility is dilapidated in a way of some sort. The WDCs can then escalate that to the state's primary care development agencies or boards, as the case may be, depending on which states is in control, and then from there look out for solutions, right? For facilities that are BACPF facilities. I'm sure my guy will still talk a bit about BACPF funded facilities. They also have adequate structures where the WDCs are involved within the BACPF structure, such that they can then say, okay, these are the issues with our primary healthcare, our facility, and these are the things that we need to do. So I would encourage for women to always speak up and to always, raise their concerns. And if their concerns are not addressed at facility level, then they can then escalate it to their community leaders through the World Development Committee.
Okay, make I do follow up with you, Ibukun, because I go like make we understand them in a layman English.
Okay.
It be like when me and you do our office, we commit. Admin, na in the summer me and you query. And admin, we will go report to if anything happen. Admin, tongue go come, carry go meet or go at the top. So, okay, now this one they happen, we not finish. But in this case now for this healthcare, where these women want go report them to. You know, say some places they go just put some box like that, put your complaint inside the box. How we want to take no say that they go through those papers, say okay, make we read this. Person they read down. And what did this women talk? Now this one they raise, now this one they not raise. How we want take no? And where that one not they work. Just like I give example, say admin. You feel waka go meet admin or you send email. Who these women want go meet for this facility? Say okay, we want report this so thing, or we want petition. Where they want waka go?
Yeah, thank you for that. I think it's still the same because the word WDCs, they are made up of community members. They are not. It's not one government person that is in one other city. There are people that are within those communities already. So there are people that the women know. They are the community leaders. They are the youth group leaders or the women leaders. They are the ones that make up the WDC. So the women can easily just go, if their concerns are not being addressed at facility level, they can go to their community leader and say, oh, this and this and this and this is what happened, though. See what happened. Then that person is now responsible for escalating it to the WDC because they are members of the WDC.
Okay.
So that's essentially the structure of the WDC, such that it is made up of community members, so that the community themselves have a right to almost like guide how their facility is being run.
All right, thank you so much. Meanwhile, my phone lines they open 070 0995 0995. I just get like a minute or two to pick call, so that you self go they part of the conversation, especially for you where they use these their health care centers, and you hear waiting with they talk. All right, 070 0995 0995. While we there at that, and here and your guest in the studio, you know, good afternoon. He said, if you come primary health care for massacre, if you collect cards today, the next day when you go, that same hospital, bye, they go tell you, say, they not fit find your card. So you need to buy another one. He said, this one makes sense. So does it mean, say, some of this health care, they never upgrade, say that they use system or something, and even if they get cards, they not get proper documentation?
Okay, so let me answer this question, but then before then, I request if you want me to add a point to what my brother said.
Feel free, sir.
What development committees are part of facility management committee?
Yeah.
We are making community members to be part of leaders of each facility.
Dr. Bello, I beg no verse. Hello. Yeah, good afternoon inside this afternoon.
Good afternoon.
All right, would they follow us talk and where are you from the call? All right, we're there with you, sir.
Okay, so I just want to say we are integrating communities into the management of facilities. So this WDC, which we call World Development Committee, that will be selected by people in the community. Their chairman and secretary are part of facility management committee. Every decision that the facility will take, they will be part of that meeting.
Okay.
Secondly, this basic care provision for each quarter, each three months from Abuja here, we sell hundreds of thousands of money to facilities, at least one per ward. And they cannot spend that money until that member from the community sign the check. Just to show you how we are bringing the community to ensure that accountability. And this is like a wake-up call. Each and every Nigerian should know that every three months, in their major PSC facilities in their ward, we send money from Abuja to take care of their local needs, so that it is the facility with these community members will sit down and identify a problem in the facility to solve. Secondly, records.
Record.
There may be a problem with record. I cannot say no, but we have two-way. When we open a card to a client, we give a small card because it carries a number. Sometimes people will come, they will forget that card. Nobody will remember numbers. So it is that card number that we will use to trace. And sometimes if we cannot find it, then we open temporary card. So it is all these, it is two-way actually. But I have a good news for all of us.
Okay.
National Primary Healthcare Development Agency, this challenge you put, we have already answered it.
Okay.
We are working to have what we call electronic community health information system, in which our major PSC facilities will have system that all this record will be in computer. When you come, it is either you call your name or that number, then they will search your name. This issue of missing card will be an issue of the past.
Oh, okay.
By end of this year, we will be able to roll out this program. We are starting now with the community level. We have some workers, health workers that are recruited to go house to house to ensure that pregnant women and children get the services. So we are not even allowing them to come to the hospital first. We are going to their homes to tell them these are the services that you need.
Okay.
This is the facility you can go to get it, and we link them to facilities. Where they need transport, we link them to emergency transport system. We are going. There are some states that have started this active, and we are just coming from Bauchi to initiate that. Kaduna, Kano, and Yobe have started. 10 other states, Ikiti, Bayelsa, and Plateau. So states like this.
Okay.
And we are going to other states. So we are even reaching to the pregnant women to their homes to tell them what are their needs, what are the services they need, what are their rights, and then we link them to facilities. And we are using phones like this and computers very soon to start this. And then at the facility, we are using electronic medical record. So we will be solving this problem. But meanwhile, it is where the client will come. That small card itself, they have missed it. They come, it will be very difficult to trace, especially in facilities that have high volume of clients.
Okay.
But where we have missed record, probably there may be some lapses with the healthcare workers, and the methodology we have mentioned, the various ways of seeking redress should be approached.
But is it sustainable? Like if person need transport, you bring it to the person. You know, we talk about a lot of things, but the implementation, it go work.
Which one?
Everything you just mentioned now, you talked about bringing the maternal health care to the women.
I'm telling you, we have started.
Yeah, and it's sustainable.
We are recruiting, before we use volunteers. We call them community health influencers, promoters, and services programs. We recruited women largely, mostly women, and we pay them some transport money, 5,000, 7,000. But we realized 5,000, 7,000 is not enough in today's Nigeria. So we encourage the state, and we have resources. We are piloting in some LGAs that have major problem. These people are recruited. Government is paying them minimum wage. They are going. It is government. They are under government payroll.
Okay.
And in 10 states, we have recruited more than 3,516 of them, and they're going house to house. So
okay, house to house in the communities.
Community. They will be looking at who is pregnant in this house. Have you started antenatal? If not, you ask why. And then try, maybe some of them is ignorance, some of them they do not see the benefit. So they discuss with them, and we have seen an increase, more than 33% increase in antenatal.
So it's like bringing the DHC to them now, instead of them running from it.
Instead of them going, so they are bringing it to them.
Telling them that these are the services that are available to you, and then try to talk to them on the importance of the services. Okay. And encourage them to speak up.
All right. If I did talk to in our times, I go just forget say, time don't go.
We still get more time to
soup
to ask.
Soup was sweet. Soup was sweet.
Now money kill them.
So I get less than 2 minutes. Okay.
So
Ibukun?
Yes. So waiting women and these communities now members fit do to improve maternal health care and to eliminate unnecessary out-of-pocket expenses?
I like what you said last around out-of-pocket expenses, because obviously one of the things that we have realized as the major challenge to women accessing services is money, is the economy. Some people would say, why should I take all this money and go and give hospital when I've not eaten? Like, so the economic situation is something that needs to be put on the table. But understandably, there's something that has been done to address that as well. And I think a lot more women need to know. There's something called health insurance, for example. And as Nigerians, we're always very, very weird about health insurance, but we need to understand that health insurance is not it's not a doom message. It's not saying that, oh, I will need hospital at some day. It's just a fact that at some point in my life, I might need medical services. And the essence is that I should be able to have access to these medical medical services and not suffer financially because of it. Because we have seen situations where even in urban climates where a medical issue can lead to poverty for people.
True.
In the essence that they are not able to afford the care that they need. So one thing that I would encourage people to do is to go and get health insurance. The financial implications are not that expensive. I'm sure Malga can share a bit more about what it means to get health insurance or how you can get health insurance. But that health insurance essentially guarantees you or gives you access to the care that you need. And there are basic, even for the most basic health insurance that you can find, there are already some level of access of services that you will get for free. For example, antenatal services, you get it for free once you are subscribed under health insurance. So let us not wait until it happens before we say, okay, we want to go and bring money, or we have health. Once you have health insurance, you can then get those services for free, right? So that's one thing that I would really like to really emphasize in terms of this is one of the major barriers. So this has already been addressed. So why don't we key into it
and just take advantage of it?
And take advantage of it because there's health insurance. So let us use it. And there are different levels of health insurance. There's the national health insurance. There are state health insurance. There are even community level health insurance. Some communities come together and say, okay, let us pool funds together and do this, right? And also, the government is also very, there's been some level of thinking around, okay, what about people that can't even afford the initial premium for health insurance? So that's why there's something called the Vulnerable Group Fund that essentially is...
Our time don't go.
The Vulnerable Group Fund is targeted at people that cannot afford to pay for health insurance or to pay for health services.
Make I cut you. This one make I use my own minutes to ask you this question to my own detriment right now. But now because it involve my women and anything will be body matter, women I know they take and play. Now we they talk about insurance. May they get insurance, they go this, they go that. For hospital or for healthcare, we not get equipment. I be the ones who not get enough hand we be say go cater for these people. Now that one you want to put mind for insurance. Because some people, yes, even no matter how you make them attractive, you say that place, no, they go there. Make them kill me. I never die. You want make them kill me. I know they go. Then because of some character dirty way some people get inside that place. And apart from that, some of these healthcare facilities, they don't get equipment.
They know they even open for nights. When we get one pregnant woman, we complain that time. Say, when she go for night, the place they locked.
What? Nothing that night while cause those nurses their job. Now when they take complaints, they say, I see they be for night. So that kind of one now, you think say if you bring insurance, come, the women go tell you, say, want to come and register for insurance. Oh, go over you now. So we need to think of better ways. Oga, they do like this. Oga, you go pay me for the next minute. I don't close.
Oga, they get good news for us.
Don't close.
Make we hear the good news.
Women are our mothers, our wives, our daughters, and our sisters. You see, we are missing the point. As I talk to you now, if you go to our website, that is what we call PHC dashboard. That shows you the entire
PHC dashboard.
Yes, in MP that it's in www.mpscity.gov.gov. It shows you the total number of primary healthcare facilities in the country with their location and their categorization. Out of the entire 9,000 wards we have about, we have more than 26,711 facilities. But only 3,137 are functional. And we have them by location.
Okay.
Because we have facilities by category. Not all facilities are equal.
Dr. Bello, I want to
And
go
then
back.
If you want to do insurance, you will choose facility. If you go to the website, you will choose facility that we have republished. 3,300.
All right.
Thank you so much.
Dr. Bello go.
Thank you so much.
Until next week, Monday, again, still on top of your Chukma
Thank you,
station.
Dr. Bello. Thank you,
99.5
Ibukun, for
Wazobia
coming.
FM.
To tackle pressing issues in our nation, such as unequal maternal health care services, gender-inclusive agricultural support for small-scale women farmers, access to loans, and much more, the International Center for Investigative Reporting presents Spark, a 30-minute radio program aimed at igniting discussions on these challenges and providing solutions to them. Spark airs every weekday on different radio stations across Nigeria. Mondays, Wazobia FM Abuja, 3:30 p.m. Tuesdays, Agidigbo FM Ibadan, 4:30 p.m. Wednesdays, Anambra Broadcasting Service ABS, 1 p.m. Thursdays, Prestige FM Mina, 5:30 p.m. Fridays, Rock City FM Abeokuta, 11:30 a.m. Spark is supported by the International Budget Partnership, IBP.